Hi, I'm Mick Raich. I'm the CEO of Vachette Pathology and of Stark Medical Auditing. It's been a couple weeks since we had an update via video, so let me talk about some things we got going on. First of all, happy holidays, Merry Christmas, Happy Hanukkah. It's been an interesting year. I hope you've survived. I hope you've done well. I hope you've found an angle to continue to do your business strong and to come up with solutions going forward into the new year. Let's look at some of the things that are going on. First things first, we have a relationship with the panel of national pathology leaders. I'm actually on the board there. It's a great group of pathology leaders from around the nation. They all get together and look at business ideas and concepts. And just to let you know, they have a survey they're doing. It's a 4-question survey, and it's about topics they'd like to see addressed going forward. As next year they're going to do a series of virtual roundtables, and they want your feedback. What do you want to talk about? So. You can look them up at, there's a note on our website for that, and you can click on that, and that'll help. Or you can see the link in our next newsletter that'll come out. So there'll be some information there. All right, fee schedules. CMS fee schedule cut, 9% for pathology. It's ugly. What's the good news? Well, one positive takeaway was CMS decided to accept the RUC's recommendations to increase work RVUs for molecular pathology interps. This is the G0452. Overall, the code's total global payment will jump to $46. It's a 125% increase from $19.12. So that's the good news. Here's more good news. I don't know if you heard about this, but we're pushing this right. This is House Representatives Bill 8702. This bill basically says it would delay the cuts that were implemented this fall by creating a payment mechanism that would restore any cut services to 2020 rates. So the 2021 cuts would be temporarily frozen while the E&M payment boost would still happen. So what they're doing is they're saying we're going to boost, remember the way the fee schedule was changed is they boost E&M payments and decreased ancillary provider payments. Well, this bill helps boost the E&M payments without cutting the ancillary provider payments. Let's hope this finds its way into the next stimulus package or the next government spending package as it goes forward, because this will prevent a lot of drama. You look at times this year when most of the groups were down 2.5 months of half billing. Most labs were shut down to 40%. This would be a great way to prevent some of that damage. Don't forget, if you're applying for a MIPS exemption, and a lot of people are applying for that MIPS exemption, due to the impact of the public health emergency, the deadline to do so, to apply for this, is December 31st. If you receive the full exemption, you will receive a neutral payment adjustment and a corresponding 2022 payment. Remember, this is 2 years, goes 2 years forward, so 2020 actually affects 2022. If you don't apply for the exemption, your reporting is due by March 31st of 2021. If you have questions on this and you're wondering how to do it, give us a call. We'll work with your practice manager. We'll work with your group. We'll help this out. It's kind of like the PPP money and some of the other things we did. We're here as a resource for that. So just look us up on the website. Give us a call. We'll do our best there. Here's a question. We're doing an audit now, and when's the last time you audited your addendum cases? Because these cases are complex and they have extra CPT codes on. And what we found that in some of our audits, 50% of the addendum cases are either double billed or they're not billed at all. So if you're doing anatomic pathology and you have addendum cases, take a good look at that. Maybe audit that. Maybe. Here's another thing we're working with billers on, and this is a tricky one. Can your biller track non-balanced billing of COVID patients? Can it track all the COVID ICD-10s and make sure that they're not balance billed to the patient? We feel this is going to be a huge audit issue next year as the OIG looks at this, and they're going to say, look at all these payments and all these balance bills that were sent to people who had COVID. That's going to end ugly. If you're not auditing this, if you're not looking at this, if you're not researching this, save some money because they're coming to take it back. Give us a call. We'll work with your biller or your billing staff, and we'll figure out how to have a plan of this. By the way, this should be in your compliance report too. Just a little thought there. All right, a couple other things. The No Surprises Act. We think surprise billing is going to be passed through and pushed through. What it basically says, patients will be held harmless from surprise medical bills for emergencies in non-emergency cases in which the patient cannot reasonably choose an in-network provider. Patients would only have to pay the in-network cost-sharing responsibilities for the care, while providers and payers would negotiate payment for the rest of the bill. So basically they're saying you have to negotiate if you're out of network. Well, there's some good news here, there's some bad news here. If the parties cannot agree on an out-of-network rate within 30 days, they must access an independent dispute resolution process, which in a third party would then consider the rates proposed by both the payer and the provider. And then they would negotiate that out. The good news is many states already have surprise billing laws, and they have some pretty strong out-of-network billing rates. So this might even be a windfall for some people to be out of network, because you might get paid more out of network than you would in network. Interesting angle? Terminate contracts to make money through surprise billing laws? Think about it. All right. A couple other things here as we finish up. A reminder, the 2021 clinical lab fee schedule rates will remain frozen at 2020 levels. In 2022, test rates are subject to cuts up to 15% to account for the initial PAMA reporting. Remember we reported PAMA for the labs a while back? Well, meanwhile, the next round of payer data will be reported by affected labs in the first quarter of 2022. So if you got a lab and you're up and running and you're doing COVID and your volumes are through the roof, take a good look at this revenue. Take a good look at this impact. This could be a big impact for you. So you've got revenue going up because of your COVID testing, but everything else might be coming down because of PAMA. So who plays those numbers? Who audits those numbers? Who runs those projections? We do. Give us a call. We'll help you out with that. All right. Last thing. It's really good news. A bunch of our practices, small practices, 2, 3, 5-man groups, they call us this week and they're getting checks for hundreds of thousands of dollars. And they're like, where's this money coming from? Well, this is phase 3 of the CARES Act. And these are really big checks. And if you haven't got yours, you might want to call us. This is based on the volume of their 2019. What Health and Human Services began phase 3 relief funding distributions. A total of $24 billion with a B is going out this round to providers. Payments first went to those who had not already received the 2% of their annual revenue from patient care. Remember, you got 2% of your patient care revenue. And then they went and reviewed applications for those who reported lost revenue or change in net revenue expenses due to the pandemic and decided to cover up to 88% of the reported losses. 88% of your loss? You tie this into PPP money? You're not going to have that bad of a 2020. Well, your PPP money dropped things, covered a bunch of stuff, right? And then this comes along and covers 88% of your covered losses? Yeah, look into it. This is big money, hundreds of thousands of dollars. 5-man group, $300,000 to $400,000. Crazy big numbers. $24 billion. Who's your advocate here? Who's fighting for this? I think you should find one, and we'd be happy to help you. Again, I'm Mick Raich, wishing you a happy holiday. I'll probably give you another one of these reports as we go towards the end of the year here. If you have any questions, give us a call. We'll do our best to help you out. Thanks a lot.